Hello, I welcome you to my presentation about nursing leadership in clinical practice. I hope that I cope with your expectations and provide you with enough understanding of the topic. My name is Muhammad Umar. Alexander explained that leadership in nursing has crucial significance to achieve organizational objectives, provide quality care to the patients, and effective management of employees in healthcare setting. With the increase in awareness about quality and safety of care among the patients, they expect the best patient outcomes with higher level of satisfaction from nurses and leaders in healthcare setting. Introduction and its outline. I would like to discuss and explain the concept of nursing leadership and its importance for healthcare organization, employees and patients. To cover these aspects, first I would present the definition of nursing leadership derived from contemporary literature and my own understanding about it. Secondly, I would discuss the significance of nursing leadership for my healthcare organization, patients and the employees specifically, and also the general importance for this aspect. Lastly, I would present my definition and preferred leadership style and the reasons for this preference. Let's start with the definitions. Giddings argued that leadership and nursing are related to each other because nursing in clinical practice requires effective leadership to transform the expectations of nurses, organization, and the patients into effective and positive outcomes. Whereas V.C. Stephen and Grimley explain that a nurse leader is one who has the responsibility to influence subordinates and teams and inspire them to achieve organizational goals and meet the obligations expected from them. However, Salvage and White added that along with managing teams to meeting organizational objectives, nurse leaders will also have to ensure the quality and safety of care in clinical practice and enhance patient satisfaction and outcomes. Adding to the discussion, Bender explained that a nurse leader should have a vision and mission of enhance patients and employees' outcomes and motivates and empowers the employees to pursue this vision and mission by leading them effectively. With the help of these definitions and the help of the contemporary literature, I have devised my understanding of nursing leadership. Nursing leadership encompasses the motivation and inspiration for employees to meet the organizational objectives, empowering them and influencing them to increase their productivity and actively engaging with the patients to make them satisfied with the highest quality and safety of care provided. Importance of nursing leadership. Nursing leadership is important not only for my organization but also for my general healthcare and environments. It is crucial to note that nursing leadership is important to meet organizational objectives and goals. If the nursing leadership is ineffective, the organization might not be able to meet the objectives and deliver poor care services to the patients. Second objective is quality and safety. The quality of care is also dependent on effective nursing leadership because nurse leaders devise strategies to deliver health quality and safe care to the patients. Third objective is patient satisfaction. This can result in reduced or enhanced patient satisfaction if the nursing leadership is supportive and effective. The patients will get safe and quality care and they will be satisfied. The last one is financial implications. This would impose financial problems to the organization and over functioning of the organization will be disturbed. If the patients are satisfied, they would spread a good of mouth, and if they are not satisfied, they will not return to the healthcare organization. Importance of employees. Moving to the second aspect of the importance of leadership, it is important to mention the importance of nursing leadership for the employees in healthcare setting. Therefore, I would like to draw your attention to the notion that where nurse leaders are not supportive and use dictatorship over the employees and negative workplace environment or culture is developed from where no works with satisfaction or motivation. With a negative workplace environment and culture, employees are unable to perform well and they just get rid of their task and avoid confrontation with their leaders. It is against the implication of nursing leadership to the role model and supportive icon to the employees. The performance and the productivity of the employees also depends on the role of nursing leadership. The employees who have continuous pressures and neglected support from the leaders in healthcare setting becomes prone to negative health issues like depression, anxiety and tend to drugs usage. The employees usually leave the organization and their motivation for work reduced along with their satisfaction. Thus, employees' retention, satisfaction, and health at workplace are also associated with nursing leadership. The leaders at my workplace have supportive roles and they engage the nurses and employees in decision making and listen to their queries. This results in positive workplace aspect. Importance for patients. Turning to the third aspect of the nursing leadership, it is imperative to highlight its importance for patients. This is important. With a strong, effective and supportive nursing leadership, patient outcomes are enhanced. It provides best patient and safety. These practices also leads to the enhanced quality of care. The nurses and other employees in effective and supportive leadership perform well efficiently and provide best quality of care. These employees work with dedication and motivation and they become proactive under the umbrella of their leaders. This leads to an efficient services and the patients to the errors committed by nurses are reduced. With such leaders and nurses, the patients become satisfied because their needs are effectively managed. All of this leads to patient satisfaction and patient-centered care. Because care nurses leaders influence the nurses and employees to follow their practice that directly benefit the patients and their needs. When the leadership focuses the task completion only, there is no relationship between and it diminishes the patient-centered care. Thus, nursing leadership is also important for patients critically as evident from these mentioned aspects. Preferred leadership style and its reasons. As far as my preferred leadership style is concerned, I would recommend the transformational style. In this leadership, the leaders inspire, motivate and encourage the teams to involve their work practice and follow the ones that would cater in their growth organization. The major reason why my preference of organization in transformational leadership style is focus on the teams. The leadership style enhances the skills and capabilities of the teams and attends to every team member. In clinical practice, the nursing leadership with transformational act as an ideal for the nurses and the other staff. The transformational leaders in clinical practice make the nurses aware of their roles to provide patient-centered, high quality of safe care to the patients. The leader himself follows the same path. The transformational leader in clinical practice has the following foundational dimensions that caters to the enhanced patient outcomes, employees outcomes and organizational outcomes. First is ideal. The nurse leader acts as a role model of the nurses and has charisma and influence over them. He or she involves the nurses in decision making and enhances their skills for organizational growth and follows the same practices. Second is inspirational. The nurse leaders inspire the nurses to work in collaboration and work. Nurses are confident to discuss the matters with the leaders related to their performance, patient issues and work related problems. This leads to the relationship between the leaders, nurses and the patients and results in enhanced patient outcomes. Third is intellectual. These aspects make the nurses adopt innovative and creative practices for patient care and effectively. This leads to efficient organizational outcomes because organizational objectives are met efficiently. Fourth is individualism. This aspect centers on individuals' nurses' needs and skill. The nurse leaders handles the queries of individual nurses and the result of enhancement in employees' outcomes, that is increased performance, retention and satisfaction. Fourth, last is conclusion. The explanation of these points bring me to the end of my presentation. To summarize these 4 points, I covered nursing leadership entitling managing nurses teams to enhance their performance in meeting organizational objectives, enhance patient safety and quality of care to satisfy them. Leadership is important in clinical practice because it impacts employees, patients and healthcare organization. With the effective leadership, nursing many benefits are achieved. That is many organizational objectives, quality and safe care and meeting organizational objectives, quality and safety of care, patient satisfaction, financial benefits, employee satisfaction and retention, performance of healthcare benefits, patient-centered care and patient satisfaction and reduction in errors by nurses. My preferred leadership in the style is transformational leadership style because of the four dimension: ideal, inspirational, individual, and intellectual. I hope you gain knowledge on the topic. Thank you for listening and watching.